The US government is not yet prepared to authorize COVID-19 booster shots for additional Americans after allowing boosters for the immunocompromised to begin earlier this week, Dr. Anthony Fauci and the director of the National Institutes of Health, NIH, said Sunday, but both noted the government is closely watching data and is prepared to move quickly, if and when it's determined extra doses are needed. 0.3%. That's the approximate percentage of the US population that is moderately or severely immunocompromised and thus now eligible for a COVID-19 booster shot, according to the Centers for Disease Control and Prevention, CDC, leaving the vast majority of Americans still ineligible for a third dose. While Fauci and Collins declined to give a timeline for when more Americans could be eligible for the booster shot, the Associated Press reports federal health officials have been actively looking at whether booster doses could be necessary as early as the fall. Should they be deemed necessary, Collins suggested Sunday a rollout of the booster shots would likely start with healthcare workers and those in nursing homes and then, gradually, move forward to other groups from there. The Food and Drug Administration, FDA, and CDC approved booster shots for immunocompromised Americans late Thursday and early Friday, respectively. The authorization applies specifically to those that have received either the Pfizer, BioNTech or Moderna shots and does not include those who received the Johnson & Johnson vaccine. The approval came as other countries including Israel, Germany, the United Kingdom and several Middle Eastern nations have already begun or announced plans to administer booster shots to their populations, amid concerns the vaccine's effectiveness will wane as time goes on and that the shots are not as protective against the Delta variant. While booster shots still aren't officially approved for most of the US population, there's reportedly been a surge of Americans who have taken it upon themselves to get a third shot anyway, including by lying about their vaccination status to get a new vaccine appointment. According to an internal CDC document reported by ABC News, approximately 1.1 million Americans are estimated to have already received an unauthorized booster shot. Collins advised people Sunday against jumping the gun and trying to get a booster shot now, saying people should hold off until we really have the evidence. US mulls COVID vaccine boosters for elderly as early as fall. Associated Press, CDC committee approves third COVID-19 shot for immunocompromised people. Here's who should get one. Forbes. FDA authorizes extra COVID-19 vaccine dose for those with weakened immune systems. Forbes, full coverage and live updates on the coronavirus.